Hello friends. Today's video about gout and its diet management with some medicinal tips.
Gout is caused by increasing uric acid level in blood, hyperuricemia, and deposition of crystal in joints causes irritation and inflammation of tissues in the joint. Resulting in swelling and pain in the joints.
It affects primarily in lower limbs, especially targeting first, metatarsophalangeal or great toe, and small joints of feet and hands. And mostly affects man over 40.
Symptoms: extremely rapid onset, reaching max severity in just 2 to 6 hours. Often waking you in early morning. Severe pain, feels like the worst pain ever.
Extreme tenderness, even may unable to wear a sock. Marked swelling with overlying red, shiny skin, sometimes more than one. Joints are affected.
Self-limiting over 5 to 14 days with complete return to normality. There may be accompanying fever, malaise and even confusion. Okay. Now let's discuss about the management of gout. What to be avoids.
Avoid alcohol, especially beer. Avoid high purine diet seafood, red meat, dal, sugar diet, honey, cake. Soda or cold drinks.
Crabs, prawn, shrimp, egg yolk, organ meat like liver. Some vegetables like cauliflower, pulong, mushroom, Malabar spinach or puoi sok, pumpkin, okra or lady's finger.
So what to do if you develop gout? At first you should change your lifestyle by reducing body weight. Reduce alcohol consumption. Drink plenty of water, minimum 10 to 15 glass per day.
Eat more high-fiber diet like oats, broccoli, apple, orange, cucumber, carrot, banana.
Eat berries like strawberries, blueberries, cranberries, apple, grape, and cherry. Rich in malic acid, which helps to excrete uric acid from the body.
Eat more fruits rich in vitamin C, like amlaki, guava, kiwi, lemon, orange, capsicum, tomato, and other green vegetables.